New for you this morning on Daybreak, an estimated 17 people in the U.S. die every day while waiting for an organ transplant. And according to Donate Life America, 95% of adults support organ donation, but only 54 are actually registered. One Minnesota woman is now sharing her story to get more people to donate after her husband unexpectedly passed away. KIMT News 3's Madeline Watkins joins us live this morning to introduce us to her. Madeline, good morning.
Good morning, Brooke. The woman that I spoke with here in Minnesota, like you said, unexpectedly lost her husband nearly 2 decades ago. And she says while she was at came up to her right after and asked her if she would consent to her husband becoming an organ donor. She tells me that it felt unnecessary and inappropriate timing right then, and she felt overwhelmed. But now that she understands the process and how important it is, she's on a mission to help others not make the same mistake that she did. Take a listen.
It was really the very next day that I sat and I recalled all of the things that happened the day before. I mean, all of it. And I thought, God, I wish I had have said yes. I wish I had have said yes, because it was the type of person that really believed in giving.
Angel and Stuart Udine never had a conversation about what they wanted to happen to their bodies after one of them passed on.
I want people to talk when they're a sound mind and sound body, and everybody appears to be healthy, about things that are really difficult.
And it's not just about talking with your loved ones. Susan Mal Larson with LifeSource, an organ donation organization, says the biggest reason why there are fewer donors of color is due to years of medical mistrust.
That's what our work has been really focused on, is increasing the knowledge and increasing the trust. And we have found by developing partnerships and getting to know people, allowing them into our space here in North Minneapolis and engaging in conversation, we are really able to build trust.
As a transplant surgeon at Mayo Clinic, Dr. Ty Dewan tells me someone's race and ethnicity doesn't necessarily prevent matches from happening, but it does increase the longevity of the transplant, as well as creating more access to those transplants.
If I can get somebody in the Black community to donate, and somebody who is Black comes off my wait list, right? Then that allows someone else to get a kidney later on who may not have, right? So any extra donor that we put into this grand scheme really kind of almost exponentially will end up increasing the amount of people that get transplanted.
Udine says helping BIPOC communities understand the issues at hand and how they can extend or even save lives is extremely critical, because there are already so many disparities within the healthcare system.
It's the lack of knowledge and sheer ignorance to what this all entails. And the more you have conversation and you learn what the hesitancy is, you can break those barriers down pretty quickly, and people are really more willing to give the gift.
Udine tells me that it doesn't matter how old you are or even how healthy you are. As she says, the earlier and the sooner that you have those tough conversations and you tell your loved ones about it, as well as your medical professionals, then the easier it'll be when and if that time comes. Live in Rochester, Madeline Watkins, KIMT News 3.
Madeline, thank you very much. As of last Friday, there are 784 people of color on the transplant waiting list in Minnesota. If you want to become a donor, there are several ways to register. We've got a link for you on our website, KIMT.com, directing you to some educational forms.